this is Greg. Let's go ahead and jump in on this. We appreciate your time today to be able to let us talk to you about medical credentialing. Stacy, are you ready?
I'm ready.
All right, sounds good. So with this, just a little introduction to us. My name is Greg Barton. Time flies. I've been in medical for over 20 years working with, I first started with 3 urgent care clinics and working with them. And so we had providers in and out, and that whole credentialing process. Was a business manager for a plastic surgery clinic and then switched over to the EHR and billing implementation side. So kind of been on different angles of medical, which I've appreciated the opportunity to do. Stacy is our guru with this. Stacy, do you mind just giving a short synopsis about yourself?
So my name is Stacy Martin. I have been in the credentialing, well, the healthcare field for over 26 years. Responsible for overseeing credentialing for managed care organizations and for hospitals. I'm certified by NAMS, a CPCS and a CPMSM certification, and also a certified provider enrollment specialist. So over 26 years.
Yeah, you've got enough initials after your name with this, so we appreciate your experience with things. So really, I love to interview Stacy and have her talk with our clients and talk with you just about credentialing because she explains it so well. And really, one of our basics that we wanted to talk about is what is credentialing? Why has it become so important? And so, Stacy, I know we've kind of got information here, but how would you describe credentialing? What do you see as an important side of this and why it's necessary?
So I would say credentialing is basically the process for gathering and verifying information for healthcare professionals. Credentialing is a very tedious and long process. It can become complex. The payers, they're working on deadlines and timeframes. They're working their applications through a queue. So we need to make sure that, and they need to make sure that the providers that they're credentialing are indeed, up to their standards.
Right. So much of it is looking at what is this healthcare provider actually qualified for this payer. They're going to look and go, are you really a qualified provider for us and for our insured? Is that right?
Yes, you are correct.
Super. And really, is it a once and done deal? Like once you're credentialed, you can walk away and be done?
Well, no, once you're credentialed, we have to also just make sure that all of your credentials are continuously being updated. The organizations then go through a re-credentialing process. So for NCQA, which is the National Committee on Quality Assurance, they do their re-credentialing every 3 years. Hospital credentialing is done every 2 years.
Yeah. So you've got to stay on top of all that. I think really for this, so much just to summarize this, it is a long process. You need experience to be able to do it well. And what part of this is to reduce the headaches for the providers, the organizations, all of those things become part of this credentialing process. I think one of the things on this last point that I want to talk about is there really a risk of financial loss and penalties by just not keeping up your credentialing?
Yes, there is.
Yeah.
Yes.
Yeah. And so for us, it's one of those where we really want to communicate and make sure your credentialing person communicates so that the providers, your biller, everybody in your organization really understands a little bit about this credentialing process and who the provider's credentialed with for the sake of your patients and for the sake of your business. Let me jump to another screen. There's some keys really for a good credentialing process. And so part of that is assigning a credentialing coordinator. And for that, you've got to have somebody that has some expertise, that has the time, that has the detailed organization to handle this. In the credentialing, you have to understand the credentialing process to know how much lead time to give yourself with this. Stacy, what is the Stay Up to Date with Coalition of Affordable Quality Healthcare Credentialing Programs? Seems like there should be an acronym for that.
An acronym. So the acronym would be CAQH. Basically, this is an organization that houses a database where all of the providers' credentials are stored. Provider information, office information, licensure, credentialing information, malpractice information. So this is a database that all of this information is stored for all providers, every provider that
Yeah.
is credentialed by the payers.
Okay, super. So CAQH actually condensed some of this for us. Do you remember the days where each provider asked for a little bit different things and you had to upload to each provider that data?
Yes, that's a long time ago.
Yeah, not pleasant memories either. It shows we've been in this for a while with this. I think part of this, the other key for this, there's 10 here that we have listed, is link a new provider start date, is just making sure start dates can line up to what is actual for those providers on their credentialing forms and for what's realistic and what they'll do. I think the other side of this is number 5 is create a sustainable credentialing process. Again, it's not a once and done situation. You have to know per payer, what is the situation, what's going on with CAQH, how often does that need to be updated. There, so for each clinic, we really have to have somebody dedicated to this to really protect them and make sure all this is working. Is that a good summary of that?
You are correct, yes.
Okay. Okay. Number 6, don't assume that all payers will allow billing a new physician as locum tenens. So what we mean by that is just because you bring on a new provider, you have to be careful. Are you actually meeting locum tenens regulations? Or can that provider actually see that payer's insured? Or do all your patients actually, are you credentialed? Is it okay for that new provider to see them prior to them being credentialed? That becomes the issue with this.
Correct. So you want to make sure that your providers are credentialed before you start billing. It's very important.
Yes, yes. One of this is part of the credentialing process. We kind of mentioned this as the maintenance, the ongoing maintenance. There's annual, there's, what is there, a couple of different maintenances each year. And then as you mentioned, every 2 to 3 years for other payers. Is that correct?
Yes, that's correct. Yes. And for NCQA, that's every 2 years. That's for recredentialing, and for Joint Commission, that's every 2 years. But you also you want to make sure that that information is always kept up to date.
Yes. Okay. Part of this is making sure if you have a credentialing coordinator, are they communicating with your physicians to understand the necessity of giving them information, the necessity of where their status is with credentialing and with each payer and revalidation. Part of that is making sure you've got your own processes in place. Number 9, did you as a credentialing coordinator do all your homework? Do you have your list of everything that you need from the clinic, from the payer for a successful credentialing process?
Yes, we want to make sure that, and also make sure that that information, the credentials are up to date as far as current information. Yes.
Yeah, it would not be a good thing to upload a outdated license or something like that for your credentialing process, I'm sure. So making sure that's there, and then understanding your state and your payers regulations for what they're going to need from CAQH and those just for the continual revalidation.
Yes, as well as CMS and the regulatory bodies.
Right. I think in looking at this list, and by the way, we'll give you a copy, all of those in attendance, we'll give you a copy of this presentation that we're doing, but this is a painful process in a lot of ways. We talk with a lot of clinics, and so often the administrator or administrators and billers are so busy that to wedge in credentialing and to make sure you've got that sustainable process in place, all of the details necessary, it becomes really painful. I mean, even today we were talking with an office manager. They were looking at an EHR demo, and they got called by the bank and were gone from that call for 15 minutes. People are just busy. And so to try to keep into the details and the dates and when you need to follow up on the credentialing can be a very painful process for some. One of the options and what we want to present is, why is outsourcing your credentialing making sense? Again, time consuming for your clinic to track. Someone has to do this. You have to have it on your calendar. You have to be able to know when to supply the information, when to do that double check. I think for somebody like Stacy coming in with her qualifications, to have that kind of experienced person looking out for you with the payers, looking out for you with that whole revalidation is just huge. And that's what people are looking at. We don't want to reinvent the wheel with somebody in your clinic that doesn't have experience or has very little. You want to trust somebody that knows what they're doing with credentialing. Stacy, this experts in maintenance credentialing expirables. That's a lot of big words in there. Can you talk to me a
Yeah.
little bit about that, what that
Um,
is?
so we do know that credentials do expire. Your license, your CDS, your DEA, your malpractice, board certification. So part of our process and part of the maintenance plan is to just make sure that we're on top, or you're on top of those credentials that will expire. So we will send notification to your practice just to let you know that in 30 days or 60 days, your credentials will be expiring and you need to send us a current copy so we can then upload it into CAQH. And then we also keep a copy on file as well.
Perfect, perfect. Yeah. Worst case scenarios with some of these, when you have something expire, what happens? What have you seen with this, Stacy?
Well, we have insurance payers that will terminate a provider if they do not have current credentials. So we just want to make sure, and that it's very important to have those current credentials available to us, and make sure that you're maintaining that as well.
Right, right. I think the worst case scenario that I've seen with this, with something expiring, I was in touch with a clinic in the last year and a half, and they missed the Medicare renewal request and that revalidation. Just didn't see it whatsoever, and their biller caught it. I don't know whether it was a month or so later, of going, why aren't any of our claims getting paid? And so all of their Medicare claims were being denied, and once the biller found out, they had missed this. The struggle was, okay, they've already been behind, and now they've got the painful process of actually going through recredentialing, which was not a 1 month or 2 week kind of process. They were out of network with Medicare for several months until they could get their credentialing back into good standing. Financially, it was very devastating for them. And so this painful process is also just really crucial in maintaining this. One of the things that really happens with this that helps is number 4, what we have on here is we need to have a transparent process with the clinic, with your provider, with an administrator, for them to know what is the status of our credentialing. I don't want to have to think about it all the time. I don't want to track it. But if I've got a question, is there a way for me to go securely online and be able to see per application what's going on? When is our next validation? What's going up? What's going on with our next follow-up date? That kind of transparency becomes really important when you outsource, and something that we provide with this.
Yeah, so we are in the final stages of implementing our credentialing database software, where providers will have, and provider office managers will have real-time access and real-time information as to where we are in the process of the application. So notes are consistently will be put in there, and you have a username and password, so you can log in and basically see where we are in the credentialing process with the payers. So we are in the final stages of implementation.
Yeah, I love that about our organization, ready to upgrade, ready to update. How can we make this process smoother and easier for everyone? And really that software does that for us. And so I'm so excited with this, because we want transparency. A clinic needs to be able to see what's going on and what is that timeline. So it so makes sense to be able to outsource this. Some of what DrCatalyst does, how can we help with credentialing? Because you see all these steps, you see all this process. We had a clinic this week. We talked to, she's starting a new clinic in Washington State. And so she's in the process of, I need a tax ID, I need a group MPI, is my CAQH set up, all of that. And I can't imagine, she's still seeing patients with another organization, setting this up in another town, getting her building, all of those details. And so it's so great that we as DrCatalyst could step in and help with this group setup, to where she doesn't have to struggle with that. She knows it's taken care of. And again, she can see that transparency of what's going on with it. Stacy, group update. Can you give me an example of what that is?
So group update. So basically that's if we have an existing group that they are requesting to get information updated. So if it's a new address, if it's a phone number, a fax number, email address, we will, process that or submit that change to the payers.
That's super. Yeah, we have a group that's recently they just changed and went down the hall, but that's a whole suite number change, and so all of that has to be updated, and your group has to be updated then with that information. Yeah. Initial provider credentialing. We kind of have two in here. We've got steps 3 and 4. Some of that could be with your commercial payers. You could have a provider that's been practicing for 10 years and he joins a group, but he's never got credentialed with this one payer, this United Healthcare or Humana. He's just not had to be credentialed with them. So that's something we could come in and do and help cross that bridge, make sure that they have all the information they need for that payer. So sometimes it's just an initial, either with the government, whether that's a Medicare, Medicaid, TRICARE, or whether that's commercial.
Mm-hmm.
One of the things that we do as DrCatalyst is we like to customize for what the client needs for any of our services. So we don't really want to pigeonhole and say, hey, this is a blanket cost. What we do is go, how many applications do you need? We've had some clinics approach us where they've got 2 providers and they've got 8 major payers that they're wanting to credential. So, and what we can do is we could do a package to go, okay, well, that would be, do some quick math here, 16 applications that we would do, and we don't care whether those are commercial or government. We'll put together a package and help you to be able to make that affordable and make that as painless as possible, especially once you've given us that information. So I really like the package options that we have. Another part of this that you mentioned was the re-credentialing and revalidation.
Yes, so the re-credentialing, that's the re-credentialing process. Yes, I did mention that earlier, where it's every 2 years for the payers and 3 years for the payers and 2 years for the hospital facilities.
Yeah, and so we can come in and definitely help with that. It's making sure that that's done in a timely manner and that you have the right amount of time for it. Linking a credential provider with a group, it seems easy, that's all great, but it is a necessary step that you do. So let me give an example of that. You've got your organization, your clinic, you've been seeing Blue Cross Blue Shield patients and you bring in a new provider. Yeah, they're credentialed with Blue Cross Blue Shield, but you still have to link them to your group so that you as a group and under your tax ID and group NPI, you get paid for that provider services and all of that becomes copacetic. Is that kind of a clear picture of what's going on with number 7?
Yes, you are.
Okay, yep. Perfect. I love number 8, from being in practice management to know that not only can we do the credentialing, but you can actually take care of all the maintenance for this. This is a fantastic situation for us. It's a win-win. Can you talk to us a little bit about the maintenance plan?
Sure. So the maintenance plan includes CAQH maintenance. So that's basically going in, making sure credentials are updated and reattesting to the profile to attest, just to say that the information is accurate and up to date. The NPI profile updates, that's just going into the NPAS website. If there's a office address update, a phone, fax, email address, we would do that for you. Renewal reminders, if you have a credential, a license, CDS, DEA, that's coming up for expiration, we will remind you of that. Demographic updates, again, that's if an office address changes, the suite number changes, we will do that for, demographic update and submit it to the payer. Medicare, Medicaid renewal, we will complete the revalidation applications and the insurance recredentialing. That's every 3 years.
Yeah, I think part of this is knowing that you are going to track that and know when we need to take action. We get so busy at a clinic working through these things that you have some type of reminder that we see that stops us in our tracks to actually delve into that can be really difficult. And so, and when you list out all the different areas where you have to have that, it makes so much sense to go, Stacy, take care of it. We would gladly give this to you.
Yeah, we will take care.
Yeah, and Stacy, got to ask, do you hound people a little bit to go, hey, I've asked for this, you do need to get this to me?
Oh yes, that's part of that's part of credentialing. The credentialing world, you have to hound and harass and to get what you need.
Yeah.
So we submit it to the payer so they can credential the file and get the providers and credentialed in a timely manner.
Yeah, I know when I was in practice management, one email may not get it, but the second one going, I've
Mhm.
asked for this, you really need to get this, or a phone call would really help me to go, okay, I've got to stop and do this, and know that then once I got it to you, it's taken care of is just a huge relief.
Exactly. Yes.
So total maintenance plan, that that it is separate from the credentialing process. So if we need to get somebody a credential with some payers, that's great, but then we can also put them on the maintenance to make sure that that is maintained, that everything is working correctly, so those providers keep track with that and know that everything is good. Stacy, I love this slide. It's one of those where it was, what are some of the questions you and I have been asked as we've worked with this? And so, love this question. One that everybody asks is, "Hey, Stacy, how quickly can you get the provider credentialed?"
Well, we can get them credentialed as quickly as we get the information from the provider. I mean,
Right.
it's not a one and done. It's a lengthy process. So as soon as we can get those credentials from the provider, the PACOs, CAQH logins, MPES logins, we can start the process to get the provider's application submitted.
Yeah. Yeah. We've been asked this. Hey, my new provider starts in 2 weeks. Can you get her credentialing done by then?
No. We are working on the payer's time schedule and time frames and deadlines. So for
Right.
most of the payers, the credentialing timeline, it can take up to 120 days or longer. We're pretty much at the mercy of their
Right.
process, but the sooner we can get this information submitted to the payers, we have a chance to get it credentialed in a timely manner.
Right. So what I'm hearing is once you get all the information, it could take up to 4 months. And
Mm-hmm.
it's not really you, it is the providers have their line, they're taking things in order, they've got a queue,
Mm-hmm.
if you will. They're going to look at all that paperwork, they're going to take their time with it, and then
Yes.
they're going to say, hey, come back. So on the positive side, what's been the quickest you've seen as far as a turnaround? I've got all this information to this payer. What's been your quickest turnaround?
Um, I would say 3 months. I mean, that might seem like a long time, but
Yeah,
I
3
would
months
say
doesn't sound quick, my friend.
yeah. I would say
Okay.
about 3 months. Yeah. And I've seen the longest I've seen maybe 6 to 8 months.
Wow. Wow.
Yeah.
Especially with COVID. Did you find that COVID
Mhm.
slowed everything down?
Yeah. A lot of the individuals are working from home, and they're pretty much not not
They're
as
not up to
timely.
par. Yeah,
Exactly. Yes.
right. Another question we've been asked is, hey, what's your success rate at getting providers credentialed? How do you respond to that?
Well, I would say, I mean, we have a really good success rate. The only time I would see that a provider would not be credentialed is if the panel is closed or the market is closed, meaning that the payers are not accepting providers, excuse me, in that area, in that specialty. And that's where we would go ahead and try to reapply after 3 months.
Okay.
But I believe we have a good success rate.
Yeah. Yeah. I've heard that 98, 99% success
Yeah.
rate from our team. And I think the biggest thing there is going to be, like you said, is, you've got an allergy practice that wants to start up or add another provider. And if their panel looks and goes, okay, for your geographical area, we've got enough allergists. Something like that can actually slow that down and block that, but
Mhm.
we're kind of at their mercy. Another question we get is credentialing the same as contracting with a payer?
No, so credentialing is pretty much, the primary source verification, gathering all of the credentials to process the application. Contracting is where then the payers are then working on the fees and putting that contract process together. So
Okay.
it's two separate processes, yes.
Yep. 2 steps there.
Two steps.
Credentialing, you are qualified. We think that you'll be a great provider for us, what the payer would say. Second step is they're going to come in and go, here's a contract with you. Here's our timely filing days that you have to file that within. Here's our timely payment, along with a bunch of other rules. And then fee schedules are also, part of that contracting side, and that is separate from credentialing. So some of those common questions that we get asked and worked with. How do we start with DrCatalyst is one of those questions, and we wanted to give you an opportunity with this. What can often happen is Stacy and I'll get on a quick call with you. Sometimes it's only just 10 or 15 minutes, lets you get to know us a little bit. We get to hear what your situation is, what you're looking for. We like to provide lots of information for you to where you can make an informed decision. We provide a proposal and an agreement for you. We make sure that that's detailed to where it's really clear what we're going to do, what you're requesting from us, which payers for which provider. And after that's signed, we're going to start a kickoff call and really, give you access and say, hey, here's the list of things. And Stacey, I think that's sometimes the biggest challenge is clinics don't know everything that they need for credentialing. And I think your expertise coming in and going, here's the laundry list, here is the thing. So there is still a partnership, but once they give this information to you, you're off and running.
So we start the process. Yes. Yep.
Yep. So we're going to end truly, we begin immediately. Transparency is huge. So we've had clinics that I've talked to that we're doing credentialing for, and they're asking for updates, and really 24/7, they can log into a portal and be able to see, okay, what's going on with this Blue Cross Blue Shield? What's going on with the United Healthcare application? When was our last follow-up date? When's our next? What's the process?
Yeah.
So that transparency is just really helpful for us. Questions. One of the things I did want to mention is that we do have a number of people on the call. Let me look at questions through here. And I do apologize for our late start. All right, anybody have questions? I'm kind of going through our list. Okay, how does one become a credentialing coordinator is a great question with this. How would you respond to that?
I would say, I mean, there's not any sort of formal training where you can go to school to become sometimes it's just a matter of experience. You start off and practice maybe doing billing, and then billing and credentialing kind of intertwines.
Right.
So I would say it just starts where, it starts when you're working in a practice, and then you just get that experience.
Yeah, I think that credentialing coordinator, I so appreciate this question, has to be ready. It's something that the clinic administration assigns and then really puts a lot of trust in, because you have to know those processes, you have to know the deadlines, you need to know what details, but that's really part of that is becoming a credentialing coordinator. Another question we have is, how do you get CEUs for a healthcare quality professional during the weekends? How do you get CEUs for a healthcare quality professional during the weekends? David, let me get back with you on that. Let me check with my team on that. In other words, how do you get CEUs for a working healthcare quality professional who only has time in the weekend? So let's talk about that. Let me shoot you some information on that. And we will definitely give you a copy of the presentation. Somebody was asking, how do we get a quote? How do we request this online? One of the last slides that I'll make sure we have is I'll have my initial information, my contact information here. You'll get a copy of this. And so you can actually email me directly, call me directly, go to our website, drcatalyst.com, and you'll be able to ask for quotes as well. And then we've got a proposal that we can give to you. Again, we like to do just a quick 10, 15-minute phone call and get to know you a little bit and let you get to know us and help with that. Another question we have, Stacey, is how easy is it to renegotiate a fee schedule? I think the irony in this is easy probably does not belong in that sentence. What is the process to renegotiate a fee schedule?
Well, I would say reaching out to your provider relations representative, person that oversees your territory, and submitting a request.
Right. Yeah, it really is getting a hold of that provider relations. It may depend on your contract. If you've locked yourself in for 3 years, are you in some type of auto renewal? I know that I've seen some payers where they will agree to give a very small percentage of increase per year. Some of them don't even do that. And so you kind of have to look at your contract to know what are their qualifications for that renegotiation. And so many of us feel lost with that. And so that payer really has to start with provider relations and asking questions. Hey, you just got to ask that question. We want to look at our fee schedule. Can you look at me with our contract to go, when can I do that and how negotiable is that? Another question, how many providers would you dedicate per credentialing specialist? For a group of 50 providers, how many credentialing staff do you think, just kind of off the top of your head, Stacy?
For 50 providers, I would say maybe 4 to 5.
Okay. Just to make sure that all 50 now, and I think part of that question is, are we starting a new group and we're trying to credential all those, or are we trying to maintain the credentialing on those? Those are both going to be
Yeah.
a major perspective on that.
Yeah. So for 50 providers that it's just maintenance, I would say maybe 2 or 3, because you're not doing the actual, initial credentialing. It's just maintenance of credentials.
Right.
I would say between 2 and 3.
Okay, excellent. I've got another question that says, our contracts are old and I'm having trouble getting them to renegotiate. That is part of the struggle. I think credentialing can actually be, in my opinion, sometimes easier than the contracting. I feel like payers, the atmosphere or environment or culture is that the payers feel like, yeah, you're privileged to be part of our network and here's the fees and what we're going to do. So it can become an uphill battle, especially if you're a solo practice or a solo provider in a practice. I think the larger the group, you have a little bit more leverage to do that, but it does take some perseverance to get through to them, to see what they're going to do, and what is the correct timing for it.
Yeah, you're pretty much at the mercy of the payers.
Right. And there may be some things that you can do creatively with that, looking at the number of patients you have, looking at how many patients they could feed your way. Is there a way to increase that traffic? As well as then, is there a way to, at least for some specific codes, try to change your contract with that? Oh, and she was saying maintaining a growing practice for 50 providers. Okay. I've got another question that says, we've got 9 doctors and 5 offices. Let me see how easy is it to renegotiate? I think you do have a little bit of leverage there, but I think you have to get a hold of the correct person, your provider relations. And again, you need a copy of your contract to know what is the timing for that, and then who do you work with on that. So other comments on that?
No, pretty much reaching out to the providers, your provider relations representative.
Right.
To work through that process.
Yeah. I think part of it, when you have a larger group, when you have a group of 4 or 5 or 9 or 50 providers, your credentialing has got to become very detailed. You almost have to have something like what we provide, where you've got software that tracks for your clinic per provider. What is the status? When are these updates needed? What is CAQH needing? When is the revalidation for those prompts? Is that an accurate?
Oh, yes.
Okay. I love my Google Sheets and Excel spreadsheets, but I think credentialing will, you're going to have to trump that. You're going to have something better like what we provide with our software.